In our previous video, we had an in-depth discussion of the principle, angulations, and limitations of the bisecting angle technique. To overcome these limitations, there is an alternative technique that captures sharp intraoral periapical radiographic images with ease. This video explores the paralleling techniques which minimizes distortions and maximizes image clarity.
Pop quiz.
Let me take you through the process of capturing an intraoral periapical radiograph using the paralleling technique. The first step is to explain the process to the patient. He removes objects such as dentures, retainers, chewing gum, etc. from his mouth. He then wears a lead apron and thyroid collar before sitting upright on the dental chair. When he is ready, I ensure that his head is positioned in such a way that the upper arch is parallel to the floor and the mid-sagittal plane is perpendicular to the floor. I then proceed to take the unexposed intraoral film packet and fix it to a RIN XCP film holder that consists of a beam aiming ring and a bite block. The film is placed at the edge of the bite block and the patient bites into it. This holder ensures a parallel placement of the film to the long axis of the tooth. When placing the film packet into the holder, I ensure that the white surface of the packet faces the teeth with the identification dot towards the occlusal end of the film. Other holders that can be used include precision film holders, stable bite block, easy grip film holder, and hemostat with a bite block. Before we move on, it is important to understand the 6 key principles that ensure a sharp image on the radiograph. Firstly, the focal spot or the source of radiation should be as small as possible. Secondly, the focal spot object distance should be as long as possible. Thirdly, the object film distance should be minimal. Next, the parallelism between the long axis of the object and the film should be maintained. The fifth principle is ensuring the X-ray beam strikes the object and the film at right angles. And lastly, the tube, film, and patient should not move during the exposure.
Pop quiz.
Now let us understand the paralleling technique and its relationship to the principles. The film is placed in the patient's mouth parallel to the long axis of the tooth of interest. The curved anatomy of the palate makes this possible only if the film is placed at the center of the oral cavity, therefore increasing the distance between the film and the object. But according to the third principle, the object film distance must be as small as possible to get a sharp image. To compensate for this image distortion, we increase the target film distance to 16 inches by using a long cone or position indicating device. Therefore, this technique is also called the long cone technique. The long PID is positioned aiming at the ring of the holder. This ensures that the X-ray beam is perpendicular to the long axis of the tooth and the receptor. With this projection, the tooth and the image are represented as opposite sides of a rectangle. Therefore, we get an image length that is equal to the tooth length. In other words, we have successfully captured an image with no distortion. Based on the 6 principles, let us compare the paralleling technique to the bisecting angle technique. In the paralleling technique, a film is placed parallel to the tooth, whereas in the bisecting angle technique, it is placed at an angle. Object film distance is large in the paralleling technique, while it is less in the bisecting angle technique. In the paralleling technique, the source to object distance is long, while short in the bisecting angle technique. X-rays are directed perpendicular to the tooth and receptor in the paralleling technique, while they pass perpendicular to the imaginary bisector in the bisecting angle technique. The focal spot size is minimal in both techniques. Movement of the tube, film, and patient is avoided in both. From this, we can clearly conclude that the paralleling technique gives us a more accurate image since it fulfills four of the key principles for attaining a sharp image, while the bisecting angle technique fulfills only three. Hope this video has helped clear your concepts regarding the paralleling technique. In our subsequent videos, we will discuss other radiographic techniques. Here are four basic rules of the paralleling technique. Feel free to take a screenshot. We hope you had fun learning with us.